A pleasant day to all of you. Welcome to our class on bioethics and sexual ethics. I am your professor, Father Jonathan T. Candis. Our topic for today is about the nature of theological bioethics. Many people face several bioethical issues every day. Let me give you some examples. Number 1, JM, an incoming first-year seminarian of Don Bosco, suddenly experienced symptoms of COVID-19 days before he is scheduled to enter the seminary. He was brought to the hospital by his parents, and when the result for the swab test came, the doctor informed his parents that he is infected with COVID-19. The parents decided not to tell this to JM because it might affect his mood and his disposition. JM is about to enter the seminary in a few days. Do you think the reason of the parents is justifiable? Do you think JM has the right to know the truth? Second example, a newly married couple is experiencing difficulty having a child. And since they know that you are a good student of theology, they come to you for advice and ask the question, "Brother, is it okay to undergo in vitro fertilization?" What will be your answer? Third example, AC, your friend, had a heart attack and was brought to the ICU. The doctors told you that there is less chance of survival for AC because of the gravity of the heart attack. He is in comatose and he currently depends on life support. Do you think it is right to pull the plug, meaning to remove the life support, which will eventually lead to his death? Last example, GC, your brother, had a kidney failure. He is looking for compatible donors who are willing to donate one of their kidneys to him in order to live longer. What if your kidney is compatible with his body? Is it ethical to donate your kidney to your brother? These are just some situations that the course on bioethics will help us answer these questions. And hopefully we will find the answer to these questions as we go through the course on bioethics. Well, the term bioethics was coined by Dr. Van Rensselaer Potter. He is not a relative of Harry Potter, a fictional character in J.K. Rowling's novel. He is an American biochemist who kept on thinking, what term can he use to somehow integrate medicine, biology, and human values? And thus, he coined the term bioethics. That was in 1970. He wanted bioethics to be the bridge between science and humanities. Etymologically speaking, bioethics came from the words bios, meaning life, and ethics, meaning ethics. It is life ethics, or the ethics of life sciences. It is a normative science. It is not a technical science. Technical science would refer to biology. Since we are studying ethics, it is a normative science that studies moral principles, values, norms, and practices concerning biomedical interventions on all life, especially human life. There are many ethical theories in approaching bioethics. We need to know that bioethics started as a secular science. And just as there are many ethical theories in determining what is good or bad, for example, the school of utilitarianism would say the ethical thing to do is to choose that which is useful for you. The hedonistic school would say the ethical thing to do is to choose that which is most pleasurable to you. There are many schools, many system of beliefs, on ethics. But our concern here is theological bioethics. And what is theological bioethics? It is bioethics in the perspective of faith, and in our case, our Christian faith. Theological bioethics argue from reason and faith, meaning to say, discussions on theological bioethics would involve philosophical and theological arguments. Now, what is the main difference of theological bioethics from other kinds of bioethics? Are these fundamental truths of our faith? As Christians, we have a different way of looking at reality. And that perspective is something we bring into bioethics. That's why theological bioethics is different from any brand of ethics because of this kind of perspective. What are these fundamental perspectives that theological bioethics is coming from? First, the dignity of the human person as the image of God. We look at the human person not just as an animal, but as an image of God. We were created in the image and likeness of God. We look at the body not as a prisoner of the soul, as Socrates would say. We look at the body as the temple of God. We look at life, health, and suffering not just from the secular and materialistic view of reality. We look at life, health, and suffering from the way how Jesus taught us to value our life, to take care of our health, and the value of human suffering. It can be redemptive. It has a value that can teach us, that can help us share in the passion of Jesus. And we look at death not as the end, but as a door leading to eternal life. So these are some of the beliefs that makes the approach of theological bioethics different from secular bioethics. Let us look at some of the contribution of the Catholic tradition on medical ethics. Let us name some of them. First, Clement of Alexandria, a famous Greek philosopher and theologian who taught at the School of Alexandria. He condemned the practice of contraception. Saint Antoninus of Florence, he was an Italian Dominican priest who became Archbishop of Florence, Italy. And he told physicians to tell the dying person of the imminence of death. That is important. If you have a patient or a relative, wherein his medical condition would indicate that he is about to die, then Saint Antoninus would say, we have the obligation to tell the person, but in a compassionate way. Saint Augustine of Hippo, the son of Saint Monica, a famous philosopher and theologian, shared with us his teachings on sexuality coming from his experience, and also he taught Christians that we should not commit suicide to avoid suffering. That is important. Theologians Domingo de Soto and Domingo de Bañez, 16th century theologians, explain the distinction between ordinary and extraordinary means of treatment. Now that is important. Later on, we will try to go deeper to the meaning of these two distinctions. The ordinary or the obligatory treatments, or the extraordinary or the optional treatments. So this would depend on situation of the patient. And there are many other theologians. So the important role of Christian bioethicists and moral theologians is this: present and explain the teachings of the church on bioethical issues. That is why we need to study well the teachings of the church, the teachings of our faith. We need to study our theology to be able to explain well the teachings of the church on certain bioethical issues which people face every day. So where do we find these teachings of the church? Let us look at some of the sources. First, Humani Vitae, the papal encyclical of Paul VI. It discussed the church's teaching on responsible parenthood and married love. Married love should be faithful, free, total, fruitful. That's number 14 of Humani Vitae. And also the transmission of human life. The encyclical condemned the practice of contraception. The Declaration on Procured Abortion, or its Latin title, Quaestio de Aborto, emphasized the church's teaching on respect for life and the right of human life of embryos from the moment of conception or fertilization. So, another document, Declaration on Euthanasia, it explained why euthanasia or mercy killing is not the most compassionate thing to do for a person who is suffering from terminal illness. Because some persons would think that way. Because a person is suffering from terminal illness, the most compassionate thing to do is to end the suffering, to do mercy killing. But it is false compassion. It is considered as a crime against life. And that is what we can find in the Declaration on Euthanasia. Donum Vitae, the gift of life, presented the church's teaching on reproductive technologies. Up to what point can we use technology in procreation, wherein it can be considered as morally correct? Is IVF morally acceptable? Is surrogacy morally acceptable? These are some of the questions we can find in Donum Vitae. Of course, Veritatis Splendor of St. John Paul II, it is his encyclical on fundamental moral theology, which you have perhaps encountered in your course, Fundamental Moral Theology. Evangelium Vitae, another encyclical of John Paul II, on promoting the sacredness, the value, and the culture of human life in order to oppose the culture of death. The Charter for Healthcare Workers, it is a synthesis of the Church's teaching on Christian morality, and the formulation of the Charter is very practical, especially for healthcare workers, to serve human life from the beginning up to its natural end. There are two versions of this. The first version came out in 1996, and the most recent one came out in 2017. The instruction Dignitas Personae on certain bioethical questions is actually an update of Donum Vitae. Due to the developments in technology and science, there were certain matters that were discussed that were not discussed in Donum Vitae because it did not exist yet during that time. So this instruction, Dignitas Personae, would include those matters in discussion. It would include discussion on stem cell research, human cloning, gene therapy, and many other developments. Of course, we cannot forget the Catechism, the Catholic Church, the Catechism for Filipino Catholics, and also certain documents coming from the Pontifical Academy for Life. This is not an exhaustive list of the sources we can have regarding theological bioethics, but we can start from here. And as we go through the discussion, I will quote some of these documents for us to be able to see its importance in dealing with bioethical issues of our time. I would like to end by sharing with you some paragraphs from the Hippocratic Oath. The Hippocratic Oath is an ethical code attributed to Hippocrates. He is said to be the father of medicine, a Greek physician who lived in 370 BC. And this Hippocratic Oath was used by physicians throughout the centuries as a guide in practicing their profession. Many medical schools adopted modern versions of this oath to make it relevant given the advancements we had in the field of medicine. Let us look at some paragraphs that will be somehow relevant in our discussion on the principles in bioethics. I will apply dietetic measures, meaning something to do with food and nutrition, with diet, for the benefit of the sick according to my ability and judgment. I will keep them from harm and injustice. I will neither give a deadly drug to anybody who asks for it, nor I will make a suggestion to this effect. Similarly, I will not give to a woman an abortive remedy. In purity and holiness, I will guard my life and my art. Whatever houses I may visit, I will come for the benefit of the sick, remaining free of all intentional injustice, of all mischief, and in particular of sexual relations with both female and male persons, be they free or slaves. What I may see or hear in the course of the treatment or even outside of the treatment in regard to the life of men, which on no account one must spread abroad, I will keep to myself, holding such things shameful to be spoken about. If I fulfill this oath and do not violate it, may it be granted to me to enjoy life and art, being honored with fame among all men for all time to come. If I transgress it and swear falsely, may the opposite of all this be my lot. So these are just some of the paragraphs from the Hippocratic Oath. It is interesting to note that the Hippocratic Oath was formulated centuries before Christ. It means that even during the ancient times, the time of the Greek philosophy, certain actions were already seen as good or bad. Certain actions were already seen as evil and is to be avoided. It tells us that morality is an important concern and guide for all of us. And this is the concern of this course. And as we continue with this course, we hope to learn more on the Church's teaching and present it, especially in dealing with the bioethical issues of our time. Here are some of my sources for this lecture, and hope to see you in our next class. Please take note of your assignment and also the reading material for this learning module. Have a good day, keep safe, and God bless.